My name is Hodges Davis. I'm an orthopedic surgeon based out of Charlotte, North Carolina. I specialize in the area of ankle and foot surgery. I practiced for 31 years. In the fall of last year of 2023, I retired from clinical medicine. I continue to stay very active in bringing along new surgeons as well as new technologies. Fusion has been a central part of the solutions that we can offer in the ankle and foot. The ideal bone graft is autograft, and autograft is from the patient itself. It's the safest because it's the patient's own bone. It's got the cells that are needed to form bone, and ideally it's easy to get to. So the cow graft is ideal because everything is right there. You don't have to prep a new site. The foot's already prepped. When we first started, we literally would make a hole with one of the instruments in one of the trauma sets, and it was very difficult to get more than even just a little bone. We subsequently had some harvesters. The problem with it is you just never knew how much you're going to get. You certainly never knew how much you got with the pass, so you would do multiple passes. And with each pass, you increase the chance of donor site morbidity, which in the autograft world is the worst thing. I always loved the concept of a clear tube, so I knew exactly how much graft I was going to get. The second is I really didn't know what was happening inside the grafter, whether I was losing graft, where I was getting graft. And the more we started developing around a clear grafter, we really found that we were losing significant amount of graft as we were backing up with the suction, and it was fun to figure out how to stop that from happening, and we were able to do that with VisiCore. VisiCore is the best. I think it's the best because it solves all the problems that we had with previous bone grafters. I now know how much bone I'm getting and how little bone I'm getting. I know something about the quality of the bone before I take it out of the tube and try to put it in the patient. I know that I don't have to do multiple passes to get exactly what I want, and I know what I want before I go into the procedure, and I know what I've gotten after I've done the harvesting. So the reason that VisiCore is the best is it solves our problems. And at that point, as a design surgeon, I feel like I've done my job.